Breast cancer affects millions of women in the United States as the second leading cause of cancer-related deaths. Black women are especially at risk of developing and dying from breast cancer compared to women of other races. Early detection can improve treatment outcomes and save lives. Mammograms are a powerful tool in the detection and fight against breast cancer. A mammogram is a quick X-ray that can identify abnormalities in the breasts long before they can be physically felt. Every woman aged 40 years and older is entitled to a free mammogram under the Affordable Care Act every year. Make mammograms a priority in your healthcare routine. It's a small step that can have a huge impact on your health. Let's work together to empower women.
Black men, we stand tall, we lead, we protect, we show up for our families, our communities, our people. But when it comes to our own health, too many of us stay quiet. And that silence, it's costing lives. Here's the truth. African American men are twice as likely to die from prostate cancer. Twice. But listen, when caught early, it's 98% treatable. That means getting checked isn't just about you. It's about being there for the ones who need you most. Fellas, if you're 45 or older or have a family history, it's time. The exam is fast, simple, and it could save your life. Strength isn't just in what we do, it's in the choices we make. Don't wait. Take control of your health today.
I'm just going to make some introductory remarks and then open it up to questions. So an international traveler with measles was in Boston from June 7th to June 8th. During their stay, the traveler visited several public locations and may have exposed other individuals, so we are alerting the public. What we're telling people is that if you visited the following locations during the following times, you may have been exposed to measles. The Westin Boston Seaport Hotel, and that includes restaurants within the hotel between 5:30 p.m. on Saturday, June 7th and 1:30 p.m. on Sunday, June 8th. The Museum of Fine Arts Boston between 1 p.m. and 6:30 p.m. on Sunday, June 8th. Logan International Airport, Terminal C, between 5 p.m. and 11:15 p.m. on Sunday, June 8th. And then on June 8th, the person flew on JetBlue flight 639 from Boston to Miami, and that flight departed at 9:12 p.m. So measles is a highly contagious infectious disease. It spreads easily through airborne transmission. When someone coughs or sneezes, the droplets are aerosolized, and they can remain in the air for up to 2 hours after the person exits the space. Droplets can also land on surfaces, and if you touch those surfaces and then touch your face, you may contract measles. But measles only lives on surfaces for up to 2 hours. I want to emphasize that our strongest defense against measles is vaccination, which is highly effective and very safe. It is usually given with mumps and rubella vaccine, so that's MMR vaccination, measles, mumps, rubella vaccine. Ideally, people should receive 2 doses, 1 dose at 12 to 15 months of age and the second at 4 to 6 years of age before kindergarten. 2 doses are 97% effective at preventing measles, and 1 dose is approximately 93% effective. Unvaccinated individuals who are exposed to measles are at highest risk of contracting measles. If you are vaccinated, there is a low risk of transmission. You are unlikely to develop measles even if you are exposed. Most of our residents in Boston have been vaccinated. Nearly 94% of children locally have been fully vaccinated against measles, and that's according to State Department of Public Health data. Full vaccination as a child confers lifelong immunity in most people. In other words, someone who has been fully vaccinated with 2 doses of MMR is considered protected for life. Turning to symptoms. Once exposed to measles, symptoms usually appear 10 to 14 days later, but symptoms may occur as early as 7 days and as late as 21 days following exposure. Initial symptoms include high fever, cough, runny nose, and red eyes. Koplik spots, or small white bumps in the inner cheeks, are also highly suggestive of measles. 2 to 4 days after the initial symptoms begin, a rash appears, and that starts on the face and it spreads downward. The rash looks like small flat spots or raised bumps, and it's not particularly itchy. Please note, though, that the rash may not be characteristically red in darker skinned individuals. Certainly, we have a very diverse population in Boston. It may appear dark brown or even purple, or it may be difficult to see. People with measles are infectious to others 4 days before the rash appears and then 4 days afterwards. I think it's also important to note that in people who are unvaccinated, measles can cause very serious illness. Approximately 20% of people who get measles will be hospitalized. Serious complications include pneumonia, brain inflammation or encephalitis, and as we have seen during this current national outbreak, death can occur. Milder complications include ear infections and bronchitis. Unvaccinated individuals, infants who have not yet been vaccinated, pregnant people, and people with weakened immune systems are most at risk of severe complications. So what do we want people to do if they've been exposed? Anyone who visited the locations mentioned during any of the times and dates mentioned would be advised to check their immunization status. And you can contact your healthcare provider, or you may have your own written records. If you or your child were exposed and are unvaccinated, you should contact your healthcare provider immediately for further guidance. While waiting for further guidance, you should monitor for symptoms and avoid public spaces for 21 days following exposure. If you and your child are vaccinated, you should still monitor for symptoms, but you may continue with your normal activities. Your risk is low. If you or your child develops symptoms, please call your healthcare provider before presenting to your clinic, your urgent care, or the emergency room if you can. Presenting for care with measles may put others at risk. Wearing a mask is also advisable if you're able to do so. And if you don't know your immunization status, we urge you to get vaccinated with at least one dose of measles, mumps, rubella, MMR vaccine. This is safe even if you've previously been vaccinated, and it will provide protection against future exposures. Specific questions about this measles exposure can also be directed to the Boston Public Health Commission at, and I'm giving you the email address, it's infectiousdisease@bphc.org. Individuals should expect a response within 24 hours. For the latest information and guidance, we've updated all of our information on our website. It's boston.gov/measles. And for healthcare providers who suspect measles, they should call the Massachusetts Department of Public Health at 617-983-6800 for recommendations and testing guidance. I also just wanted to share briefly what we are doing at the Boston Public Health Commission. Certainly, we are notifying the public of the potential for exposure, and that's why you're here this morning. We are also leading contact tracing and are working with the exposure sites. So we've been in close contact with the Westin Hotel and the Museum of Fine Arts, and we're providing direct notification to guests. For the exposure at Logan Airport and the flight that I mentioned, so Massport and the CDC, they handle contact tracing and notification of passengers, and we'll be leading that process with us and the CDC. So we'll all be working together. I would also say that, as we collect more information, we will notify the public and individuals directly. So I'll stop there and take any questions.
Thank you, Commissioner. Does anyone have any questions? From Emma, do you know where this person contracted measles?
No, we don't.
I'm going to come off mute. I'm using my phone. This is Jennifer with GBH News. Are you able to give any more details on how the contact tracing and working with the MFA is going?
It's going well. We've been in direct communications with them since yesterday, late afternoon, evening, and we, have a letter a notification that'll be going out to anyone who was a guest at the MFA on June 8th during the times that I provided. So we are in close contact and we're working on this together.
Thank you, Jennifer. Eve says means of transportation used by that person to move around.
We have no indication that they use public transportation. And I think that's a very important point. We mentioned, or I mentioned that, they were at the Seaport Hotel, then the Museum of Fine Arts, then at Logan International Airport. We don't have further details in regards to how they got from each individual location.
Also from Emma at BZ, has anyone been contacted yet that has been exposed? Did they have symptoms, and are there concerns this could become a more widespread problem within the city and surrounding areas?
We are currently in the process of contact tracing. We have not heard about anyone else who is a suspected case. I think it's important to note, as I mentioned, that our vaccination levels in Boston are rather high. They certainly could be higher, but nearly 94% of children locally have been fully vaccinated against measles. And so, though we are certainly concerned and we're doing the work that I described, we are a city that is protected from a large measles outbreak.
Thank you. Any other questions this morning?
Hey, Asher here from NBC Boston. When was the last measles exposure in the city?
The last time we had an uptick of cases, is that what you're asking?
Well, this obviously isn't a confirmed case, so I don't want to make it into something it's not. But I can't remember the last time the city sent out a warning about a potential exposure like this.
So this is an actual case. So this is a confirmed case of measles from somebody who traveled into the city, as I mentioned, on June 7th and June 8th. My understanding is the last time we had an uptick of cases in Boston was in 2011, and there was an increase of cases statewide. I believe there were 24 cases of measles statewide that year. And then we had a number of cases in Boston. But on average, there are 0 to 2 cases per year of measles in Massachusetts. So you're correct. It's not something that's common. And I think that that's a testament to our vaccination rate.
Thanks.
One more question. Doctor, you mentioned at the beginning that this was an international traveler, I believe. Is there any information you could share on where they were coming from?
So I cannot share a lot of details in regards to patient level information. Just I can tell you, like I said, that they were coming from out of the country, but they actually came into the city. It was local travel, meaning that it was domestic. They came into the city domestically, so it wasn't an international flight. That's why we didn't mention, or I did not mention an initial flight into the city. I mentioned it a flight out. I hope that's clear.
I think so. Just so I'm understanding correctly, though, they did not arrive, for example, at Boston locally from a country or a country
That's
abroad.
correct. That's correct.
Got it.
Correct.
Okay, thank you.
Thank you.
If I could just add, Payan, just one point, just to clarify something I said earlier. I think everything that we're doing is about preparedness. We've seen these outbreaks nationwide, and we certainly don't want that to happen here in Boston. So we have been working intensely as a public health commission to inform people about measles and to increase vaccination rates more recently as we've seen what has happened nationally. So this has been a process that didn't just, start with this case. It was really something that we've been working on for a while. When I said that we are not a city where we will necessarily see a large outbreak, I think many cities across the country have seen a number of cases. We're hopeful that we will not see many cases in this instance, and we're hopeful that we will not see a large outbreak. But we are preparing and trying to be as careful as possible and doing the contact tracing, as I mentioned, and encouraging vaccination that will hopefully protect us from any additional cases or any large outbreak.
Breast cancer affects millions of women in the United States as the second leading cause of cancer-related deaths. Black women are especially at risk of developing and dying from breast cancer compared to women of other races. Early detection can improve treatment outcomes and save lives. Mammograms are a powerful tool in the detection and fight against breast cancer. A mammogram is a quick X-ray that can identify abnormalities in the breast long before they can be physically felt. Every woman aged 40 years and older is entitled to a free mammogram under the Affordable Care Act every year. Make mammograms a priority in your healthcare routine. It's a small step that can have a huge impact on your health. Let's work together to empower women.
Black men, we stand tall, we lead, we protect, we show up for our families, our communities, our people. But when it comes to our own health, too many of us stay quiet. And that silence, it's costing lives. Here's the truth: African American men are twice as likely to die from prostate cancer. Twice. But listen, when caught early, it's 98% treatable. That means getting checked isn't just about you. It's about being there for the ones who need you most. Fellas, if you're 45 or older or have a family history, it's time. The exam is fast, simple, and it could save your life. Strength isn't just in what we do, it's in the choices we make. Don't wait. Take control of your health today.